Good afternoon, family. It's a beautiful day, and we are so glad that you will be with us for the next hour as we broadcast on Philadelphia's own WURD Radio 900 AM, 96.1 FM. I'm your host, Dr. Sophia Shabazz, and welcome to the Her Health Matters radio show, where we amplify the voices and stories of African American women and share actionable steps that can improve our health and wellness. We come to you on the fourth Sunday of every month from 2 p.m. to 3 p.m. We're also streaming online at WURDradio.com. Today's episode, Healing Out Loud, Black Birth Stories Rewritten, tackles one of the most critical health crises facing our community. Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women. Behind these devastating statistics are real mothers, real families, and real stories that demand to be heard and honored. We have 3 powerful voices joining us today who are transforming how we think about birth, healing, and advocacy in our community. From birth support to mental health counseling to documentary filmmaking. Each of our guests is rewriting the narrative around Black women's birth experiences. For our Let's Get Lifted segment, focusing on mental well-being, I'm joined by Jumi Kirby, the founder of Relinquish and Transcend Counseling and Consulting, a virtual holistic private practice. Jumi is a certified perinatal mental health specialist and mindfulness-informed professional who seamlessly integrates nature-based therapy and mindfulness into her therapeutic work. In 2019, after enduring a deeply traumatic journey through trying to conceive, pregnancy, and the birth of her second child, where she wasn't treated with the care and support she needed, Jumi was inspired to create a space for healing and transformation. Her passion for holistic well-being drives the practice, where each therapist focuses on a unique niche to provide personalized and compassionate care. Licensed in New Jersey, Delaware, and Pennsylvania, Jumi is committed to serving diverse communities through individual therapy, workshops, and consultations. By connecting people with the healing power of nature, she fosters emotional resilience and supports them in their journey toward well-being. Welcome to the show, Jumi. For our listeners who may not be familiar with the term, can you first explain what perinatal mental health is?
Yes, perinatal mental health is a range of different mental health conditions, ranging from perinatal mood and anxiety disorders like depression, anxiety, postpartum OCD, postpartum PTSD, and that's often related to birth trauma. And then there's postpartum psychosis. That's rare, but it's very, very serious. And then there's a bunch of like different mood disorders that's linked to infertility, miscarriage. There's emotional distress related to the NICU stay, birth complications, or perinatal loss. And with perinatal mental health, these conditions are very, very common, but it's under and misdiagnosed. It's often minimized, and unfortunately, if it's untreated, perinatal mental health issues can only affect, well, not only affect the birthing person, but the infant development, the partner relationships, the overall family functioning. So I hope I answered your question.
You did. And now, Jumi, you're a mother of 3, but your journey into motherhood or your journey of motherhood included profound loss. That experience shaped not just who you are as a mother, but as a healer. Your practice is called Relinquish and Transcend Counseling. What does relinquish and transcend mean to you and the work you do?
So the name is deeply intentional. Relinquish speaks to the process of letting go of the shame, the pain, the unrealistic expectations, and the internalized narratives that like no longer serve us. And then with the word transcend, is all about rising, the reclaiming of identity, joy, peace, and your power. And, don't get me wrong, it's not about bypassing the pain, but it's about honoring it enough to grow beyond it, if that makes any sense.
Transcend or sort of rise up.
Yeah.
When you tell people that you specialize in perinatal mental health, what type of reactions do you get?
So they often say that it's needed, right? But then they also think that perinatal mental health is just all about postpartum depression,
Mhm.
when it's so much more than that. Becoming a mother is a seismic shift, right? Your body, your identity, and your relationships all transform. So there's grief, there's joy within that. And then in addition, there's trauma. And it's not necessarily talked about, but there is trauma within healthy births as well. And for Black and Brown mothers, there's often a layer of fear and survival just wrapped up in all that. So I say that like we all need to honor the full emotional spectrum of becoming a mother, because it's not necessarily just about transformation. It's about reshaping your identity and yourself.
Guess that is part of the things that people don't necessarily understand about the emotional reality of becoming a mother. You mentioned that nature is your co-therapist. In doing some background research, can you explain what that means and share that powerful story about a client who had a breakthrough during a hike and connecting with a fallen log?
Yes, I was doing ecotherapy with a mother, and we were doing a light hike, and we decided to stop and really, one, catch our breath, but two, look at our surroundings. And while we stopped, I asked her, what about your surroundings is connecting with you? And she looked around, she looked around, she looked around, and she tried her hardest to connect with these big, beautiful trees. And she said, Julie, like, I'm going to be honest with you. I keep on trying to connect with these trees, but unfortunately, my eyes keep looking down to this withered log that's on the floor. And I told her, I was like, let's process that. And she stood silent for a moment, and out of nowhere, she just broke down in tears. And she was like, I am the log. I'm broken, I'm withered, I'm tired, I'm burnt out. And within that moment, I thought it was very, very special, because like even in our brokenness, we are still capable of nourishing growth.
Right, because even in that fallen state that feels like decay, there's life, and those fallen logs are alive and providing nourishment and part of that regenerative process. That's really powerful story. You're
Yeah.
tuned in to the Her Health Matters show with Dr. Sophia Shabazz, and today we're discussing Black birth stories and rewriting the narrative around maternal health in our community. Jumi, you poured your wisdom into your book, Healing the Wounds of Women and Mothers. What is the central wound you're addressing, and you write this book for?
So the wound is being unseen, right? The wound is carrying everything silently within yourself. The wound is generational trauma, perfectionism, and not feeling safe enough to rest. I wrote this book for women who feel like they're drowning within everybody else's needs, and for mothers who love deeply but also feel a little lost in the process. So, without telling too much, this book it offers love, validation, and a lot of just resources to help push you through.
You launched or you're launching a nonprofit called Beyond Transcendence. moment made you realize this work couldn't stay within your private practice?
Yeah, without talking about politics, it was the change in administration. And I noticed that a lot of insurance policies were changing, deductibles were changing, and it wasn't necessarily in favor of people who needed support the most. And I started seeing an influx of people who they're reaching out for therapy, they're in crisis, only to realize that their deductibles have skyrocketed or they lost insurance, right? And they wanted to heal. They're ready for this work, but unfortunately, financially, like they just couldn't move forward. So I remember sitting a little hopeless. Oh my gosh, like what can I do? Like we're turning away a lot of people. They obviously need help. Like how can I help? And that's how Beyond Transcendence was pretty much born. It was born out of urgency, in trying to create a safety net for people who are ready for therapy but blocked by these financial barriers. I really strongly believe that healing shouldn't necessarily be paused because of a deductible.
I am so glad that you had the forethought to expand into the nonprofit space so that more people could experience or do the work that they need so desperately in their lives.
Thank you.
So, Jumi, you often talk about the power of giving yourself 5 to 10 minutes a day. For the mom listening who feels like she has no time for herself, why is that more powerful than waiting for a vacation or a big self care day?
It's because small moments are honestly more sustainable than pouring into yourself every couple months. I say like 5 minutes of silence in the bathroom with no kids is everything. 10 minutes to wake up before your kids, just stretching or having a mindful cup of tea or coffee. And I don't necessarily think it's selfish, it's sacred. And these little instances that, you allow yourself and pour into yourself, it really does make a difference. And you don't necessarily need that big fancy spa day. You just need permission from yourself.
Pretty much all of us can take 5 minutes or 10, just take a
Yeah.
moment. So, for the sister listening who's been where you've been, whether it's pregnancy loss or feeling unsupported or struggling in silence, what would you want her to know?
So I would tell the sister listening that like what you're feeling is valid. The grief, the confusion, the exhaustion, even the numbness, none of that makes you less worthy of care. Um, it's okay if you don't have the words yet. It's okay if you're just surviving. You don't have to have it all figured out to begin healing. There's plenty of help out there. And you deserve access to it without shame and without guilt weighing you down.
Thank you so much for sharing your perspective, for the work that you do. How can listeners find your book, connect with you, and learn more about your work?
Yeah. So first they could follow us on social media. Our Instagram handle is namaste underscore mindful, but without the L on the end, it's a one. And our website for our private practice is www.randtcounseling.com.
Okay. RANDT counseling.com and
Yes.
namaste underscore mindful with the number one for the L.
Yes, correct.
Awesome. Well, thank you so much for sharing your wisdom and healing approach with us today.
Thank you for having me. It was a pleasure.
Now, for our main segment, Speak on It, I'm joined by Nafisa Robb, a birth doula who has been supporting families for 21 years and has attended over 250 births. Nafisa Robb is a Philadelphia native and founder of Birth Your Way, doula and birth services. With over 20 years of experience in birth work and a degree in early childhood education from Temple University, Nafisa is dedicated to empowering families through pregnancy and childbirth. Her motto, Your Body, Your Birth, Your Plan, reflects her commitment to providing trauma informed, judgment free support that honors each family's unique journey. Beyond her work as a full spectrum doula, Nafisa is an educator, advocate, and mentor who believes every family deserves dignity, support, and the freedom to birth their way. Nafisa, welcome.
Thank you for having me.
Your journey started with your own first pregnancy experience. When speaking to our show producer, you shared that story about having an episiotomy and realizing we weren't asking enough questions. What was that wake up call like, and how did it lead to you discovering what a doula is?
In the moment, I just felt like there was more. I needed more. Though they were caring for me in a way that felt loving, enough information was not being given to me. And at the end, I felt like something was missing. I needed to be more a part of the plan than I was in the time, that there should have been more information that was given to me and not me just accepting what they were saying. So the more was, let me know more. So I spoke to my mentor at the time, Sabrina Rahim, and she said that it sounded like you needed a doula,
Mm.
and that made me start researching, what is a doula, what do they do, how could they have supported me in this moment. And it was in that research that I found out that I should have had a doula.
Okay, that I am glad that you made that discovery. I am sad that it took, sounds like a pretty traumatizing or uncomfortable experience to find that. You also mentioned prior to airing of this show that nothing happened to me. I just wanted more for my birthing experience. So, for our listeners who may not know, help us understand what more looks like when it comes to birth support and what's the biggest myth you hear about doulas.
So more means informed consent.
Okay.
Allow birthing people to know what is happening to them, why is it happening, and why you're choosing what you're choosing to do to move forward. What other options are there, and not just the options that you're presenting on the table? I know this is what you want to do, but what else can I do so that I can have all the information to make the decision that works for my family? I think the myth about doulas is that we just want to do what we want to do, that we know it all and we're better than the providers, when it's not that. Each person has their zone of genius, which one of my friends at CocoLife.Black loves to say. And doctors have their zone of genius, nurses have their zone of genius, and doulas have their zone of genius, and families have their own. And when we all work together and bring our zone of genius together, we support families to be able to have a full spectrum of support in the birthing experience.
I agree with that. And I know your website talks about creating a birth team, which is what you really described. And I love that approach. Walk us through what a birth team looks like. Who should be on it? And how do you help families build their team?
Education, number one. We can't have a birth team without having a birthing person.
Okay.
So let's start with there, right? We need a birthing person, and that birthing person needs trusted support. That can be a partner, a mother, an aunt, and along that, a midwife or OB, like whatever they're choosing to do to move forward. Lactation, definitely a doula.
Mhm.
We need a doula. A lactation support therapist, as mental therapist or a pelvic floor therapist. They need those who will be able to hear them and help them create the birth experience that they desire, even if pivots are needed, that they are a part of it.
Okay. If we could get practical for a second for someone listening who might be considering hiring a doula, where should they start and what are the top 3 questions they should ask a potential doula?
I think in today's time, everyone's on social media. So while I want to say use social media, you still have to be careful on social media. But other things you can do. I know CocoLife.Black, we have service and give out doulas. There's MCC, Maternal Coalition, who also do it. There's sites like Dona, Born Bear, which you are allowed to put out your things and someone can choose you. I think it's really important. But word of mouth, I am a word of mouth doula.
Mhm.
Those who have worked with me love me. And if you like something, we tell people about it, where we got our outfits, what we do. So why not explain and tell somebody who you love as a doula and start to use them. I think some of the important questions to ask, what is your philosophy? How do you support me in my changing of pivots? And how do you work as a team? I think those are so important to know because you're going to be working with the team that we spoke about before. How are you going to work with them and be a part of the team and not pushed against it to create a birthing experience that is honored and creates a space of peace for them?
Those are great questions. So, you see your ministry as this work as a doula and use the word family instead of client. Why does that distinction matter to you? And what does it mean to advocate for yourself during pregnancy and birth?
For me, this is a ministry. It's me supporting families and giving what God has given me to support, to make sure what I needed is given to others, to make sure they're heard and understood, and being that voice of advocacy. I don't work with clients. I feel like clients are medical, and birth is a family experience. It's always been a family experience. So for me, we're bringing back family. I bring myself into their family and become a part of the family so that they are heard and honored. I'm their sister, I'm their mother, I'm their cousin. I am the voice for them in a time where they're most vulnerable. And that's what we need, bringing the village back. And I want to be a part of the village and also support them with medical terms, but doing it in a loving and concern and considerate way.
What I guess a word that's coming to mind and what you're describing is being a liaison because you may understand a little bit more of the medical than a family may or layperson. And like you said, everyone has their zone of genius in terms of the doctors and nurses, but there's still a gap, a wide gap, and you stand in that gap. So thank you for doing that.
Yeah.
If you could, I guess, if there were specific things like certifications, are there things like that a family should look for? You mentioned a couple of organizations that you trust. Can you just go back over that again? What a person searching out a doula might look for. You said social media is great, but how to separate the wheat from the tare?
Very important. Those who are qualified, those who have behind them the experience, those who follow what you believe in and your values are also important. For me, I'm certified through DONA, which is what everyone wants, right? It's that big name. But I'm also
What
certified.
does that stand for?
DONA is Doulas of North America.
Okay.
They are one of the top places where many of the Medicaid and insurance companies are looking for because of their name, because of their experience of how they train and how they support and making sure that their doulas are ready to do the work. But also Coco Life Black does that.
Okay.
I think that's amazing because what happens is even after you've been certified, you are connected with mentorship, you're connected with other doulas that can support you in the midst of going through. You may be in a birth and you don't know what to do because it takes time. I'm still learning after 21 years of this work that I can connect with someone who can support me and help me through. Yesterday, I worked with a family, and my doula shadowed me, one of my mentees, where she had hands-on experience, and that's important as well for your doula certification. How can I continue to learn in education and not just stop when the classes stop? That's really important.
That's great. How can people connect with you and learn more about birth support services? And if you could leave our audience with one piece of advice about preparing for birth, what would it be?
So you can find me at www.birthyourway.com. I'm also on Instagram as birthyourway_04. Facebook is Nafisa C. Rab, just my name. And just meet me in the community. Anywhere you see me, say hello. I'm always wearing my Birth Your Way shirt. Just
Okay.
stop and ask me
Rab with two B's.
with two B's, RABB. And I think something I want to leave is that you can trust yourself, use your voice, advocate, and no is a complete answer. Always ask for more and never accept less.
I love that. Nafisa, thank you so much for sharing your wisdom with us today. You give us that powerful nudge and support we need to ask more questions and advocate for ourselves. So, thank you so much for that. You're listening to the Her Health Matters radio program on WURD Radio 96.1 FM and 900 AM. I'm your host, Dr. Sophia Shabazz, and we've been talking about birth support with doula Nafisa Rab as we continue our conversation about healing out loud, Black birth stories rewritten. We know that birth is just the beginning of the journey. You're tuned in to Her Health Matters with Dr. Sophia Shabazz. We've just heard from birth doula Nafisa Rab We've just heard about personal support systems that can transform birth experiences, but individual support is only part of the solution. We need systemic change and policies that protect and empower Black mothers at every level. Let's examine what's happening in the policy arena with our Policy and Women segment. Here are a few legislative updates that you may find of interest. The policy landscape for maternal health is shifting dramatically, and we need to talk about both the challenges and the opportunities ahead. On July 4th, President Trump signed the One Big Beautiful Bill Act into law, legislation that includes nearly $1 trillion in Medicaid cuts over the next decade. Now, there is some protection for our community. Pregnancy Medicaid remains intact. States can continue extending postpartum Medicaid up to 12 months, and benefits for pregnant and postpartum women are protected. But unfortunately, there is a significant impact on communities like ours. The Congressional Budget Office estimates that 16 million more people will be uninsured by 2034, with 7.8 million losing Medicaid coverage specifically due to this bill's provisions. To put this in perspective, we're talking about cutting up to $1 trillion from Medicaid over 10 years, more than the entire Medicaid budget for 2023, which was $900.3 billion. The bill will disproportionately harm low income people. And expansion states like many around us will see 10 to 21% reductions in federal Medicaid spending. 16 states are projected to see their uninsured rates increase by 3 percentage points or more. At the federal level, we must continue advocating for the Black Maternal Health Momnibus Act, a comprehensive package of 13 bills that addresses every driver of maternal mortality in America. This legislation tackles the social determinants of health, like housing, transportation, and nutrition, that directly impact birth outcomes. It would extend WIC eligibility, fund community organizations working to improve maternal health, and address mental health, substance abuse disorders, and the unique needs of veterans and incarcerated populations. While the complete Momnibus hasn't been reintroduced in the current Congress, the Black Maternal Health Caucus has successfully secured over $200 million in Momnibus funding since 2023. Right here in Pennsylvania, we're seeing tremendous progress with PA Momnibus 2.0. This strategic package of 10 bills, unveiled by Representative LaTosha Mayes and Pennsylvania Black Maternal Health Caucus, is addressing maternal health deserts, creating diversionary courts for mothers with substance use issues, providing newborn supply programs, and promoting midwifery innovation. The caucus has already scored major victories. Governor Shapiro signed legislation creating a depression awareness campaign and establishing pathways for doula Medicaid reimbursement. For more information on Pennsylvania's efforts, visit pahouse.com/BMH/legislation. And to track federal maternal health legislation, check Black Maternal Health Caucus underwood.house.gov/momnibus. Change happens when we make our voices heard at every level, from local hospital policies to federal legislation. For our Making Moves segment, I'm joined by two powerful voices in health equity advocacy. Ime Alaquiva is a 4-time Emmy Award-winning filmmaker, composer. He is a White House Champion of Change honoree. He's known for his visionary work that fuses art with activism. Once homeless, Alaquiva is now the CEO of Your Mom's House Incorporated, co-founder of Hip Hop on Lock, and curator of Optic Voices. Alaquiva has been nationally honored as Black Enterprise Magazine's Top 100 Modern Men of Distinction, appointed by Governor Tom Wolf to serve on the Pennsylvania Council on the Arts and is a national BME community leader recognized by President Barack Obama. He directed critically acclaimed The Ebony Canal, a groundbreaking documentary that sheds light on systemic disparities in Black maternal and infant health. Working alongside Viola Davis, his work elevates unheard voices and sparks national dialogue, all while blending cinematic excellence with cultural urgency. Through his storytelling, Imei transforms personal pain into powerful advocacy that demands our attention and action. What led you to begin telling stories like the ones in the Ebony Canal?
Well, I started doing, I like to call artivism, where we intersect art and activism. So I started with my 8-year-old daughter, where we put together a PSA when George Floyd was murdered. We put together a PSA for the deaf and hard of hearing community. No one in our family is deaf or hard of hearing, but we felt the need to do something that was meaningful at the time. So we did that, very successful. My 8-year-old was featured on Good Morning America. Our PSA, which was only 59 seconds, went on to win countless film festivals, 300 million people worldwide, 60 countries. And she learned her voice. She learned the power of her voice, even at 8 years old. So being able to take that to Optic Voices, then from Optic Voices to the Ebony Canal, underscores what we need to do as artists to take things to the next level. So working on this documentary for 2 years, from 2022 to 2024, we followed mothers from conception, their entire 9 months of pregnancy, all the way to the child's very first birthday. So this film really centers around Black and brown infant mortality, but of course, maternal mortality is involved in that, and maternal health is involved with that. So when we think about how we can do a powerful film like this and have individuals like Kamala Harris, you have creative collaborations with Keke Palmer, you also have individuals like Dr. Lamar Rucker, and then to top it off, to have someone like Viola Davis add their voice to a film like this, even after her watching just a trailer, before we even finished the film, she wanted to be a part of this. And that underscores it's going to take all of us to really take this to the next level.
That's quite a powerful team.
Yeah.
I know the mothers in your film, women like Larissa Lane and Mariah Peoples, chose to share their most painful experiences on camera. Have they shared with you why they were willing to be so vulnerable on such a grand scale as this?
Larissa, Mariah, Alana, Rachel, bless their heart at being able to be vulnerable, especially over the course of these months, almost 2 years of their lives being sort of documented and, us following them. They understood the superhero or the super shero that lies within them. And, upon calling them and them finding out about the film, they said, whatever you need, let's make it happen. Because at the end of the day, we have to save babies. And bless Larissa's heart, baby Zori, he was only 2 days old and we lost him. So, we have to really uncover a lot of the things. We have to uncover the poor death rates. We have to, the morbidity, just all of the disparities that wrap around this. And as a father, I had to do something because often fathers get pushed out.
Right.
But how can we make sure fathers has the presence that they need? Because we understand that death rates go down considerably when there's a birthing partner or a father or a boyfriend that's in, a part of the process. So we understand these things to be true and to evident of where we are in the hole, but it's going to take all of us in order to get out of that hole, which is why we have a film, The Ebony Canal. Of course, when you think of ebony, you think of a dark shade or a brown color.
Right.
When you think of a canal, you think of one body of life to another, connecting to another body of life. So even though poetic terms of this being called the Ebony Canal, and how we all have to be vessels because Black women, Black and brown women, Black and brown babies are literally being sucked in by the undercurrents of healthcare. And we got to change that.
I'm really glad that you're doing this work and really moved by the involvement of people like Viola Davis. Can you tell us how did working with her in particular change this project? What did she bring beyond just her voice and her platform?
When you hear Viola's voice, you hear Viola's energy, period, point blank. We didn't need to have Viola, in the film, doing anything or whatnot. The fact that she narrates this and carries us through the canal. It's almost like being on the boat and hearing the announcer, over the loudspeaker. This is the voice of change. This is one of the most incredible, impeccable voices of our time. Bless, Maya Angelou, also bless Felicia Rashad, who was originally going to be the voice of this film, but she's voicing the soundtrack. Viola was just perfect. And we had a producer have her watch the teaser, which is about 3 minutes and 43 seconds. And when she watched it, something came over her and said, listen, clear everything on my schedule. I need to be a part of this. And she's focused on a lot of legacy projects. So she wanted this to be clearly one of her legacy projects. So the fact that she said, hey, listen, fly out to LA, let's go in the studio, let's cut these vocals. And it was a miraculous experience, but it was also testimony on how so many people, regardless of their celebrity, need to come together to help save Black moms and their children. That's what we need to do. And to be involved in that in a very artistic way is just mind blowing. And we're currently on a film festival run. We just won Best Documentary for Social Impact at Essence
Congratulations.
Festival. We just won 3 Webby Awards. It's more awards than any documentary this year. We just won 5 Tellys. So even though it's not about the awards, it is about putting this into a level where people sort of gravitate towards the change that we got to make. So although we're not doing it for awards and things, we are very proud and we are blessed to be able to have that. But the more eyes that are on this film, the more change we're going to have, which is why we encourage everybody in Philadelphia to come to our screening on July 29th and really, really become a vessel for this change.
And I would say that the fact that you have garnered so many awards for this film speaks to the amount of love and effort and professionalism that was put into it. It really end up with will end up with more eyes seeing the film, more ears hearing the
Yes,
stories, and more mouths sharing what they experienced. And hopefully that will help in the process of turning the tide to make
of
Ebony
course.
Canal one
I
that
see what
has
you did there,
a
turning
bright
that tide. I see what you
ending.
doing. Yeah.
Yes. I know you spent 2 years making this documentary. And
Yes.
without giving away too much for those who are planning to see it on the 29th or who otherwise haven't seen it,
Sure.
did you discover that will shock our listeners about how Black women are treated in our healthcare system?
Well, what they're going to discover without giving it away too much is this isn't a angry film. This isn't a film where, we're going to pull up to doctors in the alleyway and try to punk them and things of that nature. No. This film, and what makes this film different from like an Aftershock or other documentaries, is we really focus on 3 H's. We focus on the hurt, the healing, but also the hope. You know what I mean? Because that's what the culture is all about. Yes, we've been through a lot and there's a lot that we have to heal, but there's also hopeful solutions. There's hopeful solutions with other individuals that are in this film. Elaine Welteroth from Birth Fund, Charles Johnson from For Care for Moms, Kimberly Seals Ellers from Earth App, Lamont Thomas. These are individuals that are really focused on the new wave of solution-driven practices as we move the needle forward. So you'll be surprised that, it's not, oh my God, I feel so bad. No, we have certain things I'll give this away. When the film first comes on, you see women swimming in water, and that's not really done a lot. So from a cinematic perspective, you're going to be blown away, and you're going to be amped up to make change, period. And me as an artist, to be able to partner with Coco Black and other organizations, in the Philadelphia area to bring this film underscores what we need in the change that we're continuing to make on a daily basis. We will not be moved, but we will move. And that's what I want people to lock in.
I love that. Hurt, healing, and hope.
Yes. Hurt, healing, and hope.
Thank you so much for sharing that powerful vision of building up the Ebony Canal and the incredible work happening in our community. How should
Thank you.
people stay in touch with you? Give us your
Yes.
Instagram handles and let people
Absolutely.
know.
Yes, we would love people to become vessels on our social media if possible. We are on Instagram as the Ebony Canal, on Instagram, TikTok, Facebook, and all of the social media outlets for sure. The more individuals get involved, the more people will be sort of would love this story and would be a part of what we need to do in order to make change. So thank you all. The Ebony Canal. We love y'all.
Thank you. You heard it. The Ebony Canal on all your socials. Thanks for joining us.
Thank you so much.
Nicole Keels-McGruder is the CEO of Community Hero PA and executive producer of the Her Health Matters radio show. She is also a co-host and Philadelphia partner for the premiere of the Ebony Canal. With over a decade of experience in health equity, community advocacy, and systems change, Nicole is known for centering the voices of Black women and families in everything she leads. She currently serves as a member of the Abramson Cancer Center Community Advisory Board and formerly held leadership roles as the chair of the NAACP Pennsylvania State Conference Health Committee, chair of the Philadelphia Advisory Council of the PA Human Relations Commission. Nicole is the recipient of the 2024 Keystone Award for Public Citizen of the Year. She blends media, storytelling, and grassroots leadership to bridge lived experience with systemic impact. She holds a master's in urban planning, design, and development. Nicole, for our listeners who are inspired by what they're hearing today and want to experience this story for themselves, can they actually see the documentary?
He's very humble, but the fact that he's been able to garner the attention he has, I think it speaks volumes, and he's receiving these accolades. And I know that it's not about the awards, but I think that there is a shift, there's a need, there's just a climate shift, and that people understand the power of the story that he's telling. So I am just elated that I'm actually able to take part of this in some way and bring it here to Philly. And I just want to start off with when I was approached by Coco Life, and I mentioned, and we have worked with Coco Life in the past, so when they reached out, it was super easy to make the decision, because after hearing the story and finding out more about exactly what it was about, it was very urgent. It was a very urgent message. So when you consider that in Philadelphia, Black women represent 43% of births, but account for 73% of pregnancy-related deaths, let's just talk beyond the statistics. It's a crisis that needs immediate intervention. So when Coco Life reached out, we were like, you know what? Absolutely. This is much more powerful than a film screening. We have to give it that name. We have to call it that. But I think of it more as a community intervention, right? This is a moment for us to actually do something as a collective. This documentary brings like the emotional and educational catalyst that we need to transform this pain. Ime spoke about the hurt, but we can also transform that pain into power and create a solidarity and an awareness that we need in the community in general, and also within the solidarity that we need within the birthing community to work together as a collective. We are so much stronger. I think that a lot of individuals don't even know that this crisis exists. Community PA, we center all of our programming around equipping African American women with the knowledge and resources that they need to achieve equitable health outcomes. And not to sound too jargony, but basically we just want a fair shot, an equitable shot at living a higher quality of life than we've been subjected to historically. So this is right in line where we want to be. So to answer your question directly, July 29th is not just about a movie night. It's an opportunity for the community to come out and see the Ebony Canal. We want folks to feel it when they go home and channel that feeling and to commit to some type of change or getting involved. And after the screening, we basically want folks to feel empowered. We talked about that one statistic, but there's another one that I want to mention, and that's Black women in Philadelphia are 4 times more likely to die after giving birth than white women. So this, to me, mimics the broader systemic inequities that Community Hero focuses on. These disparities aren't accidents, but are a result of systems that haven't worked for us, for our community for quite some time, from housing to economic opportunities and to healthcare. So we just want everyone to understand that every person in that room that shows up for the screening has the power to make a change, right? So we're not going to say like, okay, yes, we're going to watch this film, but we hope that there's a fire that ignites. And what we want after this event is that women will be signing up to be doulas. They'll be investigating the best healthcare paths for them. They'll be advocating for themselves. They will demand systemic change. And that's what we want. We want these conversations and actions to become normalized in our communities. And we also want to mobilize the African American community and the community as a whole. So by the virtue of the screening, we want to do this. So it's on July 29th at 6 p.m. at the Penn Museum, which is at 3260 South Street in Philadelphia. The tickets are $9, and that price is deeply intentional. It is 9 months for the $9 that represents 9 months of honoring the sacred journey of pregnancy and making sure that the screening is also accessible to those who are typically the most impacted by maternal health disparities. So you can purchase these tickets at ebonycanalphilly.com. Again, that's ebonycanalphilly.com. The event includes a red carpet experience. There will be a post-film discussion with community leaders, maternal advocates, and it'll end with a mixer for all in attendance. So we hope that you come out. Please go visit ebonycanalphilly.com. And I just want to say it takes a community to get this work done. When you do visit Community Heroes website, you'll see a lot of other organizations that are listed on that page that are working in the birthing space and health equity space. So I encourage you to explore these other organizations, find out what supports they need, find out if you want to be involved. We are all a collective in trying to get to the same end goal. So you may find an organization that really speaks to you, and we definitely want you to reach out and get connected, because in the end goal, we're all headed towards the same thing: equity, health equity for the health of our African American women.
This really shows, because I mean, you really answered the questions that I had for you, and it really just demonstrates how you are not just the executive producer of this show and the executive director of Community Hero, but a visionary, and helping to bring this important documentary to Philadelphia on July 29th is a call to action. And I can see how it was a no-brainer to partner with Cocoa Life and the Ebony Canal to kind of have this moment and to amplify the voices of these women in their most vulnerable times, because this is a matter of life or death. So how you already mentioned, but if you could just reiterate to the listeners who hope to see the screening of the Ebony Canal and support the ongoing work of Community Hero PA, what do they need to do? How can they participate?
Of course, they can visit the website, they can purchase a ticket. But if you can't attend that night, you can still click on that buy a ticket button and donate to the cause, because a portion of the proceeds are going to go towards organizations that I just mentioned that are working so hard and tirelessly that we don't normally hear about. And this goes to support them. So those are the two ways you can help. And as I said before, you can also research these organizations and find out what type of supports they need. And they always need hands. So you can volunteer. You can amplify it on social media. That's something else that you can do. So if you follow Community Hero, we're on Facebook or on Instagram at Community Hero PA. You can share it to your Facebook groups, share it with your friends. And all these are all the different ways that you can help support the Ebony Canal.
All right, we're going to make this go viral. So that's our show for today. From birth doulas to documentary filmmakers, today's guests reminded us that health and healing happens when we tell our stories out loud and support one another through every step of the journey. This show is produced by Community Hero PA, a 501c3 nonprofit committed to addressing health and wealth disparities within the Black community. A special thank you to Nicole Keels-McGruder, the executive producer of Her Health Matters and founder and chief executive officer of Community Hero PA. During this summer season, we ask you to consider making a tax-deductible gift to support independent health programs like Her Health Matters. Your investment helps us continue bringing vital conversations about Black women's health to the airwaves. Visit communityheropa.org/donate to support this important work. Don't forget, join us July 29th for the Philadelphia screening of the Ebony Canal documentary. Details at ebonycanalphilly.org. You can catch this episode and all previous episodes on our website at communityheropa.org. Thank you for tuning in to Her Health Matters on WURD 96.1 FM and 900 AM. We'll see you next month with another engaging episode. I'm your host, Dr. Sophia Shabazz, signing off. Until next time, be healthy, be you, because your health matters. Peace.